We're most proud of at Faraday Microgrids is our ability to work in some of the most challenging environments for the interconnection of a microgrid. Now, what I mean specifically here is that hospitals and healthcare facilities have some of the tightest regulations that you might imagine. And in fact, in California, we probably have the highest level of regulation in the country, and a great deal of the country follows what California does with respect to that type of regulation. Prior to Faraday Microgrids coming about, most energy companies were entirely afraid of connecting energy systems to even what's called the normal power of a hospital. And what we mean by that is really supplementing what the grid already provides. That was considered a fairly significant breakthrough only a short time ago. What Faraday Microgrids has done is we've upped the game further. We've taken power and we've been able to connect into what's called the emergency branches, which is to say the part of hospital power which, when the utility is no longer available, becomes isolated from the grid and continues to operate the facility. Now, as you might imagine, there's no circumstance in which a hospital can afford to go down unless there's absolutely no way to continue to operate, because then patient lives are at stake. And we only need look at Hurricane Katrina and some of the other disasters around the country to understand what happens when power goes down. So what we've been able to achieve is fairly remarkable in this regard. In one of the most highly regulated environments and one of the most highly regulated regions, we've broken new ground and provided supplemental power. Now, we didn't just stop there. This goes even further. As a consequence of what we've done, the rules and regulations are being rewritten. Already, our team has participated in rewriting national guidelines, including the National Fire Protection Act 99. And our leadership is also involved with the state regulatory agency called the Healthcare Access and Information Agency, and is helping rewrite some of the regulatory codes for microgrids in healthcare here in California. Most importantly in all of this is that if a microgrid can be done successfully in healthcare, at the scale and significance that we've been able to do, then you might imagine that for your building or facilities, this would be far, far easier and incredibly successful.